Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
Hello, everyone. If you're here, chances are you're a parent, a teacher, or a caregiver who's dealing with a child's behavior that feels, well, really challenging, maybe even overwhelming. And if that's you, you're absolutely in the right place. We're going to break it all down together. It's that nagging question, right? The one that can keep you up at night. Is this just a phase? Is this normal kid stuff, just testing boundaries? Or is there something more going on here? It's such a valid worry, and today, our goal is to bring some real clarity to that question. Okay, let's dive right in. To really get a handle on this, we need to start with the language that professionals use. When we talk about behavior that's really persistent, the kind that seriously impacts the child's life, we're often stepping into the world of what are called disruptive behavior disorders. So what does this big clinical term actually mean in the real world? Well, it's not about a single bad day or a toddler having a tantrum. We're talking about a pattern of behavior, a pattern that's frequent, pretty severe, and shows up in different places, like it's happening at home and at school. It's behavior that goes way beyond what you typically expect for a child's age. Now, this is super important to get. Disruptive behavior disorder isn't just one thing. It's actually a big umbrella term for 3 different conditions, and seeing them laid out like this really helps make sense of it all. You've got oppositional defiant disorder, or ODD, which is all about that pattern of defiance and hostility toward authority figures. Then there's conduct disorder, which is a more severe pattern. And finally, intermittent explosive disorder, which is about those sudden, huge outbursts. What's really crucial here is that sometimes, if ODD isn't addressed, it can unfortunately become a precursor to the more severe behaviors you see in conduct disorder. All right, so we know the categories, but how does this stuff actually look day to day? You know, in your living room or in the classroom. Let's zoom in on the specific signs you might be seeing and, just as important, get into why these behaviors might be happening in the first place. You know, the first thing we have to get out of our heads is that there's one single thing to blame. It just doesn't work that way. It's always this complex mix, this interplay of different factors. A child's natural temperament, their genetics, that can play a role. So can neurocognitive factors, real differences in things like impulse control. And of course, the environment, things like stress at home or school, and the influence of their friends are huge pieces of this puzzle. It's never just one thing. So when we zoom in on oppositional defiant disorder, the patterns are really specific. We're talking about a child who is frequently and persistently arguing with adults. They're not just pushing back, they're actively defying rules. They have a hard time taking responsibility, so they blame others for their own mistakes. And sometimes they can be spiteful or vindictive. The key word here is persistent. This isn't just a bad week, it's a pattern that goes on for at least 6 months. Now, conduct disorder. This is where things step into more serious territory. The behaviors here involve a fundamental violation of other people's rights or major societal rules. This includes things like physical aggression towards people or animals, deliberately destroying property, a pattern of lying or theft, and serious rule breaking like constantly skipping school or running away. And then you have intermittent explosive disorder. The 2 things to remember here are sudden and out of proportion. These aren't planned acts. They are sudden, explosive outbursts of rage that are just wildly disproportionate to whatever set them off. A really minor frustration can trigger a huge aggressive episode that might even involve property damage or physical aggression. Okay, so we've identified the signs, which can feel overwhelming, I know, but this is where we pivot to the hopeful part. This is where we talk about what to do. So let's walk through what the professional process looks like for getting a real, accurate assessment and finding therapies that are actually proven to work. A good assessment isn't just a quick chat. It's a really thorough process to see the whole picture of the child. It almost always starts with detailed interviews, with you, the caregivers, and with the child themselves. Then, professionals use what are called standardized rating scales. These are basically well-researched questionnaires for parents and teachers that give objective data. They'll also look at school records to see how things are going in that setting. And this last one is absolutely crucial. They screen for other conditions like ADHD, anxiety, or learning disabilities that often go hand in hand with these behaviors. When it comes to treatment, things usually flow down 2 main paths that actually work together to support each other. On one side, you have parent management training. This is huge. It's all about giving parents and caregivers the tools to create structure, to be consistent with consequences, and to use praise effectively. Then, on the other side, you have therapies that focus directly on the child, teaching them the skills they might be missing, like how to manage their anger, how to solve problems without blowing up, and how to understand and regulate their emotions.
And I know what you're probably thinking. How long does this all take? Well, here's some really encouraging news. When these strategies are used consistently, families often start to see real, positive changes within about 4 to 8 weeks. Now, it's not an overnight magic fix, of course. Lasting change takes time, but you can start to see that initial progress relatively quickly. That keyword, though, is consistency.
So we've got the clinical side, the big picture view. But what do you do in the moment, when you're in the thick of it? Let's get super practical and talk about things you can start doing today. This might seem simple, but having a go-to script in those superheated moments can be an absolute game changer. Using a calm, predictable phrase like this one does 2 amazing things. First, it validates their feeling. I see you're upset. That's huge. And second, it creates a structured pause. Let us take 3 deep breaths. It hits the brakes on the escalation and creates a little space where you can actually talk. If you are feeling totally lost and just don't know where to even begin, this is it. Start here. The ABC model is like your detective kit for behavior. It's so simple but so powerful. For a few days, just notice the antecedent, what happened right before the behavior, what was the specific action, and the consequence, what happened right after. You'll start to see patterns, you'll see triggers you never noticed, and maybe even see how your reaction is accidentally reinforcing the behavior. This is your roadmap. And this is why doing that ABC tracking is so important. Because let's be honest, when you're stressed and exhausted, your feelings can tell you that nothing is working, that nothing is getting better. But when you track the data, you can make decisions based on facts, not just frustration. Progress might not mean the behavior is gone overnight. It might mean it's happening a little bit less often this week than last week, and that is a win. Data helps you see those wins. Now, we have to have a very serious but calm talk about safety. While most of these behaviors can be managed with the right strategies, there are some non-negotiable red flags. If you are seeing escalating violence, any talk or action related to self-harm, persistent threats to hurt others, any kind of cruelty to animals, or setting fires, please seek immediate, urgent professional help. This is about keeping your child, your family, and everyone else safe. Look, we have gone through a lot of information today, and I get that it can feel like this huge, impossible mountain to climb. But here's the truth. Change doesn't happen all at once. It happens one small step at a time, done over and over again. So as we finish up, the real question isn't, how do I fix everything tomorrow? It's this. What is the one small, consistent step you can commit to taking today? Whether that's just tracking one behavior or practicing that one calm phrase, that single step is the beginning of a whole new path.
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.